Welcome to Ophthalmology MCQ Part 4. So let's begin. Question number 16. Sudden onset of painless, profound visual loss is caused by Option 1. Optic neuritis. Option 2. Central retinal artery occlusion. Option 3. Acute congestive glaucoma. And option 4 is corneal ulcer. The correct answer here is central retinal artery occlusion. There are various causes of sudden onset of painless, profound visual loss. They are the central retinal artery occlusion, massive vitreous hemorrhage, retinal detachment involving the macular area, and ischemic central retinal vein occlusion. So the next question number 17. The useful tool to study the retinal and the choroidal circulation in normal and diseased is Option 1. Indirect ophthalmoscopy. Option 2. Fluorescein angiography. Option 3. Fundus photography. And option 4 is direct ophthalmoscopy. So the correct answer here is fluorescein angiography. Fluorescein angiography is a technique used for examining the circulation in the retina and the choroid using a fluorescent dye and a specialized camera. In this process, a fluorescent dye is injected into a vein in the arm or the hand. Then photographs are taken. The images will be captured in black or the white, as in this photograph. Next question. Question number 18. The fluorescent dye shows up epithelial corneal defects as bright green when under Option 1. Green light. Option 2. Cobalt blue light. Option 3. Yellow light. And option 4 is red light. The correct answer here is cobalt blue light. Cobalt blue light provides a suitable means of exciting sodium fluorescence, that is an orange dye, for examination of ocular surface integrity. Fluorescence mostly absorbs light of wavelengths between 485 and 500 nanometer. This then causes it to shine and emit a greenish light. Here in this picture you can see bright greenish corneal defect in cobalt blue light. Next question. Question number 19. Bloody staining of cornea is due to Option 1. Juvenile xanthogranuloma. Option 2. Herpetic uveitis. Option 3. Hyphema. And option 4 is leukemia. So the correct answer here is hyphema. Hyphema means blood in the anterior chamber of the eye. Corneal blood staining is a severe ophthalmic complication that usually occurs as a result of long-standing hyphema with increased intraocular pressure. A pressure of greater than 25 mm of mercury for greater than 5 days may cause corneal staining. In case of hyphema, maximal medical and surgical efforts should be applied to prevent corneal staining, since this condition may end up with an irreversible result of blurred vision due to corneal opacity. Here in this picture you can see the hyphema. Based on the space occupied by the blood in the anterior chamber, hyphema can be graded into 4 types. Grade 1. When hyphema occupies less than or equal to 1/3 of the anterior chamber volume. Grade 2 is when it occupies 1/3 to half of the anterior chamber volume. Grade 3 is when it occupies greater than half of the anterior chamber volume. And grade 4 is when the total anterior chamber volume is occupied by the hyphema. Next question. Question number 20. The blind spot in a field of vision represents Option 1. Fovea. Option 2. Macula. Option 3. Optic disc. And option 4 is ora serrata. The correct answer here is optic disc. In optic disc, there are no photoreceptors, that is, rods or cones, and therefore there is no image detection in this area. Hence, it is the blind spot, also known as the physiological blind spot. Thank you.